Yes. And so not only within healthcare facilities, and one of the things during Hurricane Ida was we couldn't let people go home because they didn't have power. So if they were on, if they needed oxygen concentrators at home, we couldn't send them back home because they're COPD, or if they had COVID. As I said, it was the confluence or the interaction of Delta with Ida. And so people who were needing oxygen, we weren't able to send home. But I think most facilities, I hope that part of hospitals moving forward have these, important generators in place, because disruption of life support systems can happen, such as ventilators and dialysis and other critical medical equipment would cease to function, obviously, without power. Any sort of diagnostic and monitoring equipment, including laboratory devices, this becomes completely inoperable. Drug dispensing systems may lock up, limiting access to necessary medications. Of course, we talked about HVAC systems. I mean, these happen in the summer, and these happen in areas that can be brutally hot in the summer. So any HVAC system failures can lead to temperate regulation issues, potential dangerous for vulnerable patients. And again, lack of air conditioning can be especially problematic for individuals and patients who are unable to regulate their own body temperature, which we see both in the very, very young and the very, very old. Of course, loss of power to cell towers, internet infrastructure can disrupt critical communications, and all this, of course, can affect coordination of patient care and, of course, emergency response and security risks. For example, power loss to security systems and lighting can compromise patient and staff safety, which we saw certainly during Katrina. Many stories documenting that. Fire alarm and suppression systems can be affected, which significantly increase fire hazards. Of course, things like essential services like elevators may not function, which of course complicates patient transport and evacuation. And I'm sure you've all seen the stories of my colleagues, my brave colleagues here in New Orleans. While I got shipped out to Houston, the ones that stayed here were having to literally walk and transport patients up stairwells, oftentimes eight, nine flights of stairs to get them to the roof where they were helicoptered out. So these are the sorts of things that we see with this sort of stuff. And then, of course, all of this really staff challenges. I mean, the what happens to staff with respect to mental health, fatigue from prolonged manual operations, and increased workload. And I know that we'll get to mental health impacts a little bit later. Sanitation and infection control, water pumps and sanitation systems can fail as well. Data and medical record access, the EMR, electronic health records become completely inaccessible. So, and lastly, you can see that there would be significant equipment damage as a result of power surges when electricity is restored. Certainly can damage sensitive medical equipment. I'd like to think at this point that hospitals and facilities are ready and prepared for these sorts of things. Certainly, we are here, but when we're talking about hurricanes and if maybe the hospitals are prepared for that here in the U.S. because that's part of the regulatory environment, you could see in countries that may be resource poor, that don't have those regulations in place, you may see how that exhaustive list that I just went through just now, how that could potentially impact other facilities in other countries as well.